Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about diagnostic criteria, peripheral blood features and bone marrow findings of Polycythemia vera. Polycythemia vera is a chronic clonal myeloproliferative disorder, caused by clonal expansion of an abnormal multipotent stem cell that produces erythroid progenitors that can proliferate in the absence of erythropoietin. Polycythemia vera is characterized by erythropoietin-independent erythrocytosis that is often accompanied by leukocytosis, thrombocytosis, and splenomegaly. The disease is associated with a progressive risk of transformation to either primary myelofibrosis or acute myeloid leukemia. Diagnosis criteria for polycythemia vera requires meeting either all three major criteria, or the first two major criteria and the minor criterion. Major criteria include hemoglobin levels more than 16.5 grams per deciliter in men, and more than 16 grams per deciliter in women, or hematocrit more than 49% in men and more than 48% in women, or increased red cell mass more than 25% above mean normal predicted value. Bone marrow biopsy showing hypercellularity for H with trilineage growth including prominent erythroid, granulocytic and megakaryotic proliferation with pleomorphic and mature megakaryocytes. Presence of Janus kinase 2 or Janus kinase 2 exon 12 mutation. Minor criterion include subnormal serum erythropoietin level. Major criterion 2 may not be required in cases with sustained absolute erythrocytosis, which is defined as hemoglobin levels greater than 18.5 grams per deciliter in men or 16.5 grams per deciliter in women, or hematocrit greater than 55.5% in men and 49.5% in women. Major criterion 3 plus the minor criterion must also be present. The peripheral blood film in polycythemia vera usually shows a packed film appearance. The CBC usually shows an elevated RBC, hemoglobin, and hematocrit, and normal or reduced MCV and MCH. Erythrocytes usually appear normocytic and normochromic, or if hyperplastic erythropoiesis has led to exhaustion of iron stores, they can be hyperchromic and microcytic. Slight anisocytosis may be evident, but poikilocytosis is unusual. The reticulocyte percentage is not significantly increased. Polychromasia and occasionally basophilic stippling may be found, and there may be small numbers of circulating nucleated red blood cells. The leukocytes, neutrophil and basophil counts are increased in the majority of cases. Monocyte and eosinophil counts are much less often increased, and there may be small numbers of granulocyte precursors. The platelet count is elevated in about 2/3 of cases and platelet size is increased. The MPV is raised in relation to the platelet count. CBC results and diagrammatic representation of the differential count of a 64-year-old man with polycythemia vera. A packed peripheral blood film appearance in a patient with polycythemia vera. Peripheral blood film showing normocytic and normochromic erythrocytes and a large platelet. CBC results and diagrammatic representation of the differential count of a 25-year-old man with polycythemia vera. Peripheral blood film showing normocytic and normochromic erythrocytes. Peripheral blood film showing polychromasia and a large platelet. CBC, diagrammatic representation of the differential count and iron status of a 73-year-old man with polycythemia vera complicated by iron deficiency, showing leukocytosis, anemia, increased RDW, thrombocytosis, basophilia, and the presence of nucleated erythroblasts and immature granulocytes. Peripheral blood film showing anisocytosis, elliptocytes, and some hyperchromic and microcytic erythrocytes. Peripheral blood films showing an early myelocyte, a band neutrophil, 2 basophils with abnormal granulation, and 2 erythroblasts. CBC results, diagrammatic representation of the differential count and LDH level of a 74-year-old man with post-polycythemia vera myelofibrosis, showing leukocytosis, anemia, increased RDW, thrombocytosis, leukoerythroblastosis, and basophilia. Peripheral blood film showing thrombocytosis, anisopoikilocytosis, hyperchromia, microcytosis, elliptocytes, and a teardrop cell. Composite image of peripheral blood films showing leukoerythroblastosis. Composite image of peripheral blood films showing platelet anisocytosis, from tiny to giant, and hypergranular platelets. Bone marrow biopsy may show hypercellularity and panmyelosis with trilineage growth including prominent erythroid, granulocytic, and megakaryotic proliferation. Megakaryocytes may be enlarged and pleomorphic and exhibit lobulated nuclei. Myeloid to erythroid ratio may be normal to decreased. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.